My name is Mandy Cameron, and I'm a family nurse practitioner, and I'm going to show you a little bit about the day in the life of a nurse practitioner at an urgent care. So I'm walking into work this morning. It's raining outside, kind of a dreary day. We'll see what kind of patients come in today. Good morning! We have our lovely medical assistant, Jen, and we're ready to get our day started. So typically whenever you start your day at the urgent care, you will have your morning huddle and get on the same page with your team about the way you guys are going to work for the day. If it is not super busy and there's a lot of patients in the lobby, I usually check labs in the morning and do callbacks and make sure that patients that were seen yesterday that might have been in a critical condition are doing okay today. And then we start to look at the schedule for the patients that are coming in, review their charts and their prior concerns and maybe what they're coming in for today. Usually though, in the urgent care setting, you have people coming in that aren't necessarily returning for the same complaint. It's going to be an urgent care, so usually issues that are coming up urgently. So let's go ahead and get started with our day, looking at the labs and reviewing our schedule. There are many different services that can be provided within an urgent care setting. In our urgent care setting that I work at, we do offer x-ray services. So for example, if you believe that you have a broken bone, or a medical term is called a fracture, then you can be seen here and we can image that area and see if you have a fracture. And that is done with our x-ray machine. So each morning we turn this bad boy on and we get ready to image patients. Patients are protected by wearing equipment that helps protect them from radiation over their vital organs. There are other services, of course, that urgent cares can provide. For example, EKGs, blood draws, urinalysis, rapid swab tests for COVID, flu, strep, sometimes trichomonas, which is a sexually transmitted infection. We can send out labs for that as well. There's lots of different things that we can do. There's supplies here to fix lacerations. If you do have a broken bone or a sprain, you might need some durable medical equipment, and that might look like crutches or a walking boot or maybe a post-op shoe. We clean out clogged ears with earwax, treat sinus infections, urinary tract infections, pink eye, tooth infections, rashes, allergic reactions. So there's really so much that an urgent care can do. Now then, I will say, sometimes we get patients that need to be seen in an ER setting or a freestanding ER. It's not often that urgent cares have CT machines or ultrasounds. So if you have a soft tissue injury or something going on internally, like with abdominal pain, then it may be needed that you be seen at a freestanding ER so you can get the studies that would allow for a provider to identify that issue. So just a few quick tips on what we see here in urgent care. Just like with any company, urgent cares are going to have different shift schedules. So I know some urgent cares might operate on 8-hour shifts, and they might have 2 providers cover various hours within the day, like, working from 8 a.m. until 5 p.m. and then another provider might come in at say 3 and then work the rest of the day until 8. I work at an urgent care that does 12-hour shifts, and that means that I'm here from 9 a.m. and I'm scheduled until 9 p.m. Now, for example, if a patient gets sick and they walk in at 8:58, then I do see that patient, and that does mean sometimes you get out late. I usually try and get out of work about 9:30. You may be wondering, when do I get a lunch? Well, as a nurse practitioner in the urgent care setting, oftentimes you don't have a scheduled lunch in the urgent care setting. Now, I've worked at plenty of places, primary care offices, hormonal health offices, and usually you'll get like a scheduled lunchtime. But I will say that most minor urgent cares, regular urgent cares that I worked at, Lunchtime is kind of like, you know, you eat when you can or whenever you have quote unquote downtime. So today my medical assistant, so sweet, actually offered to go pick up lunch for me, and I will be having some Chick-fil-A. I'm gonna eat this very quickly and then get about my day, go back to seeing patients. I currently have a patient that's getting imaged, and I will go review those films. I'm just gonna have a quick bite to eat. One thing that I do every day, all day, multiple times, like maybe 80 times a day, is wash my hands. I always wash my hands before and after I see a patient, before I'm going to do a procedure, just anything in general. But washing your hands is one thing that I can guarantee you every single nurse practitioner, especially in the urgent care setting, is doing all day long. As you can imagine, 12-hour shifts can be quite long. So I like to keep my home clinic with little stock supplies in the event that somebody needs something, including myself. So I recently made a little basket for our employee bathroom, just including a couple of nice lotions, hairstyling products, petroleum jelly for whatever reason you might need it for, tampons, medications, and flossers. Because hey, you never know when you might need those things. Alrighty, well, it's getting to be the end of the shift, quote unquote, and this is do or die time, basically. I haven't had much time to record all of the day because, well, it gets busy, and that's how it is in the urgent care. So I'm going to grab a quick drink because I haven't drank much liquid or water at all today because I've been so terribly busy. But typically, you know, in the urgent care, there's peak times. Usually that can be in the morning, and then usually later in the evening, it gets pretty busy because people are coming in, they don't want to feel sick overnight time. Usually in the winter months, it's busy all day, every day, all the time. So we're kind of coming out of that season. It is actually March right now, so the busy season, cold, flu, virus season is kind of passing, but we're definitely coming up on the allergy season. Cheers.